He sits in my office. Let's call him John. He's 58, a retired engineer, built bridges his whole life, solid things you can count on. But right now, his own body feels like foreign, crumbling territory. He won't make eye contact at first. He'll look at the diploma on my wall, my bookshelf, anywhere but at me. He's telling me about his golf game, the weather, anything to avoid the real reason he's here. And then it comes out. A trickle of words, just like, well, you know. Doc, he says, his voice cracking just a little. It's the getting up, 3, sometimes 4 times a night. My wife is worried. And the stream, it's not what it used to be. It's a gamble whether I'll finish before the automatic light in the men's room turns off. He shifts in his chair. This is the hard part. And I know it's a strange question. But I read something online about, masturbation. Some say it's good for you, some say it's bad. I've always been a frequent, for years. Every day, most days. And now I'm just lying awake at 3 a.m. wondering, did I do this to myself? Have I worn something out? Or worse, have I been causing cancer all this time without knowing? I'm sharing John's story, a story I've heard in 1,000 different forms for over 20 years. Because that fear in his voice, that shame, that late-night anxiety, it's a silent epidemic. And the question he's asking, the one that feels so personal and maybe even embarrassing, is one of the most important questions a man can ask about his long-term health. Does daily masturbation protect your prostate, or does it harm it? What are the real biological changes that happen inside your body? Today we're going to turn off the frantic, anonymous forum searches. We're going to shut down the fear. We are going to replace it with facts, with science, with clarity. Because what happens in the privacy of your own life shouldn't be a source of anxiety. It should be understood. My name is Dr. Alistair Vance. I'm a doctor of medical science in urology. For the next few minutes, we're going to take a journey deep inside the male body, to a tiny gland that causes a world of concern. And by the end of this video, you will not only understand what happens to the prostate of a man who masturbates daily, but you will also be empowered with the knowledge to manage your prostate health for the rest of your life. Let's begin. Before we can talk about the effects of any activity on the prostate, we need to have a profound respect for what this gland actually is. Most men only think about their prostate when it starts causing problems. For decades, it's a silent partner. So, what is it? The prostate is a small walnut-sized gland that sits right below your bladder and wraps around the urethra. That's the tube that carries urine and semen out of the body. Think of it as a gatekeeper or a crucial intersection in a busy city. All traffic has to pass through it. Its primary job is one of life's greatest miracles, fertility. The prostate produces a milky, slightly acidic fluid that makes up about 30% of your semen. This isn't just filler. This fluid is packed with enzymes, proteins, and minerals. One of the most important is called prostate-specific antigen, or PSA. You've likely heard of the PSA test. Its job is to liquefy the semen after ejaculation, allowing the sperm to swim freely and complete their mission. In short, the prostate gland is a finely tuned biochemical factory, essential for reproduction. And like any complex factory, its operations are managed by powerful forces. The two most important managers are hormones, specifically testosterone and its much more potent derivative, dihydrotestosterone, or DHT. Testosterone is the general manager, but DHT is the aggressive floor supervisor, driving growth and activity within the prostate cells. As we get older, the way our prostate responds to these hormones changes, and that is the key to everything that follows. So we have a small gland in a critical location with a vital job, controlled by powerful hormones. Now let's introduce the variable that concerns so many men: age. If you're a man over 40, you've probably started to notice shifts. Subtle at first, then less so. This is where the story of John begins for so many of us. These changes aren't your fault. They aren't a sign of failure. They are a universal part of the male aging process. The changes that men attribute to their habits, like daily masturbation, are often conflated with these three fundamental processes happening to nearly every man on the planet. Change number 1, the inevitable enlargement, benign prostatic hyperplasia, BPH. This is by far the most common prostate problem. Benign means not cancerous. Prostatic hyperplasia means the prostate is growing. By age 60, about half of all men have BPH. By age 85, it's up to 90%. Think back to our analogy of the prostate wrapped around the urethra. Now imagine that walnut slowly growing into a lemon, or even a small orange. As it expands, it begins to squeeze the urethra, just like stepping on a garden hose. And what happens when you step on a garden hose? The flow becomes weak and intermittent. It's difficult to get started. You have to push harder. And because you can't empty the bladder completely, you feel the urge to go again just a short time later. That's why you're getting up at night. That's the weak stream. That's the dribbling at the end. This is BPH. It is a plumbing problem, not a cancer problem. And it is driven primarily by age and that powerful hormone, DHT. Change number 2, the irritation and inflammation, prostatitis. The second common issue is prostatitis, which simply means inflammation of the prostate. This can happen to men of all ages. It can be caused by a bacterial infection, but far more often, especially in the chronic form, the exact cause is unknown. We call this chronic prostatitis, chronic pelvic pain syndrome. This feels different from BPH. It often involves pain in the perineum, in the lower back, or pain during or after ejaculation. It can also cause urinary symptoms, making it easy to confuse with BPH. It's a frustrating, often mysterious condition that can significantly impact a man's quality of life. Change number 3, the uncontrolled growth, prostate cancer.
This is the one that keeps men up at night, the big C, and it's a valid concern. Prostate cancer is the second most common cancer in men worldwide. Unlike BPH, where the cells are just multiplying and causing a benign enlargement, in cancer, the cells grow in an uncontrolled, abnormal way. They can eventually break out of the prostate and spread to other parts of the body. The risk factors are things you can't change: your age, your family history, and your ethnicity. Early prostate cancer often has no symptoms, which is why screening is so important. The symptoms of advanced prostate cancer can, ironically, mimic BPH. So, now we have the complete picture. A vital gland that naturally grows, can get inflamed, and is at risk for cancer as we age. Now we can finally ask the billion-dollar question. Where does masturbation, specifically the act of ejaculation, fit into this picture? We've been dancing around the word, so let's be direct. The key biological event we're discussing is ejaculation. Whether it's achieved with a partner or through masturbation, the physiological process involving the prostate is largely the same. So what happens moment by moment when you ejaculate? First, the neurological spark. The process is initiated by your nervous system. Signals from the brain travel down the spinal cord, setting a complex cascade of events in motion. Second, the glandular contraction. The prostate, along with the seminal vesicles, is not a passive bag of fluid. It's a muscular organ. During arousal and leading up to orgasm, it begins to contract rhythmically and powerfully. These contractions are what propel its fluid into the urethra to mix with sperm, creating semen. Third, the flushing mechanism. This is the most important concept for our discussion today. The ejaculation forcefully expels the contents of the prostate. It's a complete system flush. Now let's connect this physical act to the 3 age-related changes we just discussed. All right, let's put it all together. You're a man engaging in this activity daily. What is the cumulative effect on your prostate health over years and decades? Let's tackle the biggest fear first. 1. The prostate cancer connection. The ejaculation hypothesis. For decades, men like John have worried they were causing cancer. The surprising truth? The best evidence we have today points in the exact opposite direction. A major, long-term study out of Harvard followed nearly 32,000 men for 18 years. It is one of the most significant pieces of research on this topic. The findings were groundbreaking. The researchers found that men who reported ejaculating more frequently had a significantly lower risk of being diagnosed with prostate cancer.
How much lower? Men who ejaculated 21 or more times per month had about a 31% lower risk of prostate cancer compared to men who ejaculated only 4 to 7 times per month. Think about that. That's not a small number. That is a substantial reduction in risk.
This finding has been a game changer because it points to a risk factor that, unlike age or genetics, men can actually modify. Now, why would this be? Scientists have a leading theory, often called the prostate stagnation or flush-out hypothesis. The theory suggests a few things. First, clearing out carcinogens. The prostate is a gland that absorbs things from the bloodstream. This can include potentially cancer-causing substances. Frequent flushing of the prostate ducts may clear these substances out before they have a chance to do damage. It's like power washing a dirty sidewalk before the stains set in. Second, reducing crystal formation. The prostatic fluid can sometimes form tiny calcifications, which are associated with inflammation. And chronic inflammation is a known risk factor for cancer. Frequent ejaculation may help prevent the formation of these crystals. Third, promoting healthy cell turnover. Forcing the gland to regularly produce and expel fluid might promote a healthier cellular environment, discouraging the conditions that allow cancerous cells to take root. Now, a word of scientific caution. As a doctor, I must be precise. This is a very strong correlation, not yet proven causation, and the study had limitations, as the authors rightly pointed out. It's also possible that men who ejaculate more frequently have other healthy lifestyle habits that contribute to the lower risk. But the evidence is compelling and points strongly in one direction. Frequent ejaculation, whether through masturbation or partnered sex, does not cause prostate cancer and very likely helps to protect against it. So, to the John in all of us, lying awake at 3 a.m., you can put that specific fear to rest. 2. The impact on BPH, the enlargement. This is more nuanced. Does daily masturbation stop your prostate from growing? No. The growth of BPH is primarily an age-related hormonal process. Ejaculating won't halt that fundamental biology. However, can it help with the symptoms? Anecdotally and theoretically, yes. Remember, BPH creates a plumbing problem partly due to congestion. The prostate gland can become swollen not just with tissue, but with its own fluid. Regular ejaculation helps to decongest the gland. Many men with mild to moderate BPH report that their urinary symptoms, like hesitancy or a weak stream, feel temporarily better after ejaculating. Think of it like a stuffy nose. Blowing your nose doesn't cure your cold, but it certainly clears the passages and makes you feel better for a while. So, while it's not a treatment for BPH, a habit of daily or regular masturbation may help manage the symptomatic discomfort of prostatic congestion. 3. The impact on prostatitis, the inflammation.
Here, the connection is much more direct and is actually part of standard medical advice. For men suffering from chronic prostatitis, regular ejaculation is often recommended by urologists. Why? The logic is similar to the cancer hypothesis, but more immediate. In inflammatory conditions, the prostate fluid can be thick with inflammatory byproducts. Stagnation allows these substances to sit in the gland, causing irritation and pain.
By regularly and completely flushing the prostatic ducts, you are physically removing the inflammatory agents that are contributing to your pain and discomfort. It is a core part of managing the condition for many men. The science is compelling. But science often struggles to overcome decades of cultural baggage, myth, and personal anxiety. So let's address the silent questions head on. Myth number 1. You can wear it out, or you have a limited supply. This is completely false. Your body is not a finite reservoir of semen. The components are constantly being produced. Engaging in daily ejaculation simply tells your body to keep the production lines running. You cannot run out. Myth number 2. It drains your life force or energy. While orgasm does involve a brief, intense expenditure of energy, there is no scientific basis for the belief that it permanently depletes a man's vitality. In fact, the release of endorphins can act as a natural stress reliever and mood elevator. A healthy sex life, including masturbation, is associated with better mental health, not worse. Myth number 3. It's an immature or shameful habit. This is perhaps the biggest hurdle. As a physician, my perspective is clear. Masturbation is a normal, healthy, and natural part of human sexuality for people of all ages. The guilt and shame that many men carry about this act are far more damaging to their mental health than the act itself is to their physical health. We've just spent 10 minutes discussing how it is biochemically and physiologically beneficial for a key aspect of your physical health. It is time we align our emotional view with the biological reality. So, after all this information, what is the takeaway? Should I be writing a prescription that just says ejaculate 21 times a month? Of course not. Your health is more personal than that. Here is your practical 4-step guide. Step 1. Reframe your mindset, not your calendar. The goal is not to slavishly hit a magic number. That turns a natural act into a chore. The key takeaway from the Harvard study is that more is better than less. Don't keep a tally. Instead, reframe masturbation as part of your health routine, like brushing your teeth or going for a walk. The right frequency is whatever feels natural and good for you. Let go of the shame and embrace the science. Step 2. Remember it's ejaculation, not just masturbation. The health benefit is tied to the physiological act of flushing the prostate. The studies did not distinguish between ejaculation from partnered sex and from masturbation. A healthy and active sex life with a partner confers the same, if not greater, benefits. The point is simply the frequency of ejaculation, however it is safely and consensually achieved. Step 3. Build a fortress around your prostate. Frequent ejaculation is one powerful pillar of prostate health, but it's not the only one. The other pillars are just as, if not more, important. Diet. A diet low in red meat and high-fat dairy and rich in fruits and vegetables is strongly linked to better prostate health. Exercise. Regular physical activity helps maintain a healthy weight. Hydration. Drinking plenty of water is essential, and don't smoke. Step 4. Know when to see the doctor. Self-care and knowledge are your first line of defense, but you need a professional in your corner. Do not hesitate to see a doctor or urologist if you experience any of these symptoms. Blood in your urine or semen, painful ejaculation, new or persistent pain in your lower back, hips, or pelvis, a sudden or dramatic worsening of urinary symptoms, or unexplained weight loss. Early detection is the single most important factor. Let's go back to John, sitting in my office, his face etched with worry about a lifetime of private habits. After we talked through the science, after we replaced the myths with facts, I saw a change in him. The tension in his shoulders eased. He looked me in the eye. The fear was gone, replaced by understanding. He wasn't the victim of some mistake. He was simply a man experiencing the normal course of aging, and he was armed with knowledge about a habit that was likely helping him all along. The changes that happen to your prostate as you age are, to some degree, inevitable. But the fear, the shame, and the anxiety are not. What happens to the prostate of a man who masturbates every day? The evidence suggests it gets flushed regularly, clearing out potential toxins and inflammatory agents. It may have a dramatically lower risk of developing cancer. Its owner might experience less discomfort from common conditions like prostatitis and BPH.
But perhaps the most important change happens not in the prostate, but in the mind. It's the change from worrying in silence to understanding in clarity. It's the freedom of knowing that a natural human act is not something to be feared, but something that can be part of a long, healthy, and vital life. Your health is your story. You get to write the next chapter. Be well.